welcome to the First Friday show. My name is Manu, and I'll be the host this evening. Unfortunately, Trask is out this evening, so she's asked me to go ahead and replace. And of course, I said yes. Today is July 6th, Friday, and it is a live taping. So if you're watching this show on July 6th, then we will welcome your phone calls. So our phone number is 834-2886. Again, that's 834-2886. And if you have any questions, please forward them on. We'll try to get them answered on the air. Tonight's show is actually going to be a very interesting show. We're going to be talking about the Ahavahine Kuhina Papa, which is a women's conference for Native Hawaiian women specifically. And that's our main topic of our show. But before we get started, we do have some breaking unauthorized news. You may know, but we're assuming that most of you don't know, that the KS Trustee finalist list has come out, and 3 names have been pretty much put out for everybody to know and to see who is going to be chosen of these 3 finalists for our next Bishop Estate trustee. The names are Robert Nobriga, Anton Krucky, and Aulani Wilhelm. What makes this very curious and interesting this time around is 2 of those names are actually repetitions of the previous search. So we will be discussing this in some more detail on our next show. And in the meantime, let's get to the purpose of our getting together today. First of all, I'd like to introduce my first guest, which is Sharon Kaiulani Odom, here on my right. Aloha, Sharon.
Aloha, Manu.
So Sharon is, let's see, the Roots Project Director of Kokua Kalihi Valley. And maybe you could talk a little bit about that position and a little bit more about you. Our guests and our viewers at home always want to know about our guest background and genealogy.
Sure. So the Roots Project is a project about connections, really. And my background is in Native Hawaiian health. I am a dietitian by trade, but have also worked in the area of indigenous health and other cultural practices around health. So the Roots Project, though, is really interesting because it's kind of brought me full circle. And what we believe in looking at the social determinants of health is when you become disconnected from your environment, from your kupuna, from your culture, from your spirituality, from your who you are and who your people are, then your health starts to deteriorate. And what the interesting thing about food is food can reconnect you to all of these things. Food can connect you to the land, to the air, connects you to what are your cultural traditions and knowledge. What do your kupuna do? Are you eating with your neighbor? Are you sharing your food? Where is it growing? So Roots Project is all about Kokua Kalihi Valley and making those connections for the people in our valley in order to bring back health. And we do it, our motto is grow, prepare, share. So we have 100, what's really interesting about Kokua Kalihi Valley is we have a medical clinic that's down in Kalihi, and we do our basic medical services, OB/GYN, medical, dental, WIC, all of that. But what we also have is 100 acres in the back of Kalihi Valley, and we do organic forestry and farming and gardening and cooking and sharing. And so we bring people up, and whether it be to learn about growing plants and farming, whether it be cooking together, and we have everyone from Punana comes up once a month, and the kids get to work in the ground, and then we have them gather, and then we have them prepare their own lunch. And so we do that once a month. And a lot of these kids, when they first came up, we were told, they never eat vegetables. And we've been doing things like making vegetarian spaghetti sauces or paipika's, little English muffins, and they get to choose all the vegetables they want. All the way through elderly. Our elderly come up every Thursday, and they work in the garden. And we also share. So we want to know, are you sharing food with your family? Are you sharing food with your neighbor? Do you get out in the community? Do you tell stories about your food? So people, when they hear about Kalihi Valley, they don't always have, there's a lot of things that go on in Kalihi Valley, but what we did when we started our program is asked around, and the stories that came through were stories of strength, and they were stories of culture, and they were stories of bonding, and they were stories of people. And so what we do, you know, you can put a plant on the table, and the Samoan kupuna, she knows how she uses it, and the Micronesian kupuna, she knows how she uses it, and someone else. And once that sharing begins, we begin to build bridges between people and the valley.
Wow, it sounds so interesting,
I love my job.
You obviously love your job. Do you want to share anything about your ohana?
Sure. My father, Melvin Sung, is from Kapa'a, Kauai, and my mother, Barbara Nelson, is from Hunaka'a. Met away while they were away at college, and came back and raised 4 children.
4 children, and yeah, I went to school with your brother.
That's right.
Right, right. Well, welcome to the show.
Brothers. Thank you very much.
Yes, yes. Okay, my other guest here is Kim Ku'ulei Bernie. And Kim, your position is Communications Director over at Papa'olalokahi.
Yes.
And can you share with our audience at home something about yourself?
Sure. Thanks so much for including me this evening.
Our pleasure.
Papa'olalokahi is the Native Hawaiian Board of Health. We're authorized by the Native Hawaiian Healthcare Improvement Act, which is an act of Congress. And there are 3 programs that come out of that law, if you will. There are the 5 Native Hawaiian healthcare systems, and they run similarly to many of the community health centers, such as Kokua Kalihi Valley. There's a Native Hawaiian Health Scholarship Program that has funded more than 200 Hawaiians in various health professions, ranging from nursing to medicine, dentistry, social work, a nurse midwife, public health, a nutritionist. We've had 4 nutritionists go through the program. So, and that, I like the scholarship program because to me it's not an equal opportunity program. It's not about getting Hawaiians into the program. The long range goal is about getting Hawaiians to be healthy. And if they're not healthy and they're not going to the doctor, or if they're not seeking care of any kind, if one of the reasons is because there's no brown people in the white coats, then this is one way of increasing access. So it's not an EEO program. It's about increasing access to care for those that choose to seek medical care.
Nice.
Or whatever that care is. And then Papa'olalokahi is kind of like the home organization. We do policy, technical assistance, we have a research arm, we collect data and information. And I'm kind of the connector. You know, I'm not a clinician, and I need to be the expert, but I do hear about good programs, and I do have my ear on where there are needs in the communities, and I'm often able to make those connections. And these days the connections are all about food, which is why, you know, Mililani and I are here to talk about one thing, but we're also working on something else in addition, so we're actually seeing a lot of each other these days.
Yeah.
Very nice. Do you have anything you'd like to share about your ohana?
My ohana originally comes from Kohala on Hawaii Island and Nahiku on Maui, although I have family on most islands. My parents also met away. They were both born and raised here. One went to Kamehameha and one went to Punahou, and they never would have met here in the islands, but what they had in common away was that they were both homesick for the islands. So that's, again, a connection, you know, a connector.
We see a lot of that, right?
When
our ohana go to the continent. So now everybody at home knows why I have these 2, because one's going to talk about food, I love, and the other is a very good communicator, so communications director, so we don't have any problems with communication here. So our main story is really to discuss the Ahawahine Kuhina Papa, which is the Native Hawaiian Women Conference, which is coming up in August, and we really want to encourage all of our Native Hawaiian women out there to get interested and to register and to come. And so we might first start out talking about exactly what is the Ahawahine Kalamaya'u Kuhina Papa, and who, Ka'io, you can inform us a little more on that. Who were the original founders and who had the idea to do something like this, especially on this magnitude?
Well, I'm sure we're going to talk about it, but you actually had one of the very first aha wahine, and so we can discuss that. We're not going to,
Yes,
but let's talk about it. Let's talk about it because Manu deserves the credit.
Yeah.
No. Okay, go ahead.
Okay, so
You're doing good.
Okay, I remember that as being one of the first gatherings that only women were, and I don't know, what year was that, 2000?
I don't remember.
Don't
Maybe
remember.
four?
I think 3 or 4.
3 or 4.
Yeah.
And then I remember you were going to have it again, and something happened, and then
Right.
time just went on. Kim and myself were both part when the first Ahakani, the
Took
planning
place after
committee,
that.
we had helped out with that, and then people kept saying, well, you have to have an aha wahine in it, and so time went on, and then we got a call from Jerry Kaliponi, and
Right.
she was interested in doing something. So myself and Milaka Robbins went to meet with her and Anella, and they had actually pretty much thought through what they wanted to have this 2-day one and stuff like that. But we decided to take a step back and to gather women, young to Kupuna, and really talk about what we wanted to do and what the goals were and where we were going with all of this. So it took about a year, I think.
Right.
And we met. We tried to meet regularly, but everyone was super busy, so we didn't always get to meet every month. But everything from what the long-term goals were to why we wanted to do this, and really just how do we build up and support our women, what kind of things were needed. And everyone, sometimes they try and compare Ahakani and Aha Wahine, and we never wanted to do that. All we wanted to do was say, what do our women need, and where do we want to go, and how do we want to do that? And so we tried to focus on that. And one of the things was coming up with a name, and we all came to the table several times with suggestions, and we came up with Kuhina Papa, and there was a really big discussion on Ku and Hina and how we were going to keep that balance in there, and that as women supporting our men helped to make us stronger, and for men supporting their women helped to make them stronger,
Right.
and how everything that we wanted to do would revolve around that. And a lot of times, we'll come to the table and say, well, women can do this and women can do that. And yeah, we can do great stuff. And but we should all be supporting each other.
Right. I think if we look back historically and even before, the reason why you may have seen us looking at Kaiu, I'm not sure if the camera was on us at that time, when she mentioned our Native Hawaiian Women's Conference, which is what we called it. We also had another Hawaiian slogan, but I really can't remember what it was. We also had a discussion about, we are sure there are many other women gathering and doing things together and getting together and having time together. We know that the term aha wahine is used currently with other organizations. It's coupled with another organization. And so the aha wahine, when we use that term by itself, it really is a generic way of saying this is a bunch of women getting together. We're just getting together as women. But the Kuhina Papa really elevates the idea of, we have some kauna in there, the idea of men and women. We all have ku in us, we all have hina in us. And keeping that balance and acknowledging it and respecting it, even though the men aren't invited. So I just wanted to make the point that there have been other women conferences, Native Hawaiian women conferences. The one that we sponsored, we only had 100 women, and we also invited all of our guest speakers, and it had a different taste to it. It wasn't, I think the main emphasis of this aha wahine has been health, and rightfully so. I mean, we really need to address that issue in our communities. Ours was more heavy on education, politics, economics. So that sort of was more of ours, and we had a little bit of sprinkling of culture in there. And so it's been so interesting because you came to it, and then you contacted me and said, hey, we're thinking about doing an aha wahine again. And I think that you were a part of some of the other
Ahakane too.
Right, the Ahakane. Tell us
And
about
my
that.
organization did the registration and all that, which means I fielded almost all of the phone calls. And I have to tell you that probably 80% of the phone calls were from women, the wives, the mothers, the sisters, the aunties. I want my man to attend the Ahakane. You know, what do I need to do? Where do I send the papers? Where can I write the where do I send the check? And probably 90% of all the checks were signed by the woman. So I found that to be very interesting. But I found that as the event came closer, that the women were then asking, when are you going to put on the aha wahine? When are you going to do this? And one of the interesting things about the Ahakane is it's not something that was organizationally driven. It's not something that my organization or 4 organizations got together and said, we need the men to come together. Boy, do the men need to come together. That's not how it happened. The men decided it's community driven. They decided that they wanted to come together. They reached out to some organizations for kokua, and all the organizations said, yes, we'll kokua this. And so I tried to explain that to the women who called. They'd say, when are you going to do the aha wahine? And I said, well, when are you going to do that? You know, and I'll support you. And so I would say that over the years, and that was in 2006, but I would say over the years there are at least 4, 6 groups that I personally know of that had different foundations or different, they came around over different topics, but they all talked about, yeah, we should have this large aha sometime in the future, and they were working up toward it, in each in its own way. And I think the fact that this particular group is involved is just a matter of opportunity and relationships. And otherwise, if we hadn't done it, somebody else would come in and we'd be signing up for their aha wahine.
And we're also hopeful that someone else will come in and do another one in a couple of years or next year or when they get together, and we'll go and attend there, or we might present there. So that would be lovely.
Yeah. And we need to be reaching out into those women's communities, into those groups, into the halau, into the pa, into all of these different haleo papas, if you will, to reach into them, because we don't need to invent anything. I mean, women know what we want.
It's interesting when Kim is talking about the idea of answering the telephone for the Ahakane, and all these women are calling you, and I know that I was asked to help some kind of registration for the Ahakane, and I adamant, this is very interesting because it shows how diverse our group is on our committee, which all 3 of us are on this committee, are members of the committee to put together this aha wahine. And my answer to that request was, you do it yourself. You go get boys and men and do it. This is a men's aha. Women should not be doing that. So when I have some of my sisters saying, oh, I help them, I say, you shouldn't be helping them. This is a men's aha. I don't want any men helping us with our women's aha. And of course, with the mini aha, which we'll talk about in just a second, the men, most of the men prepared the food. So, it just goes to show that there's always this ku and hina relationship.
Yes.
But I know that just amongst our own committee, we talked about that, and it, as points was controversial, and we were saying, what should we do? What should they do? What will we be allowing to have occurring within our women's sacred space? So what ended up happening after the idea and meeting, one of our members, Mehana Hain, decided to do a mini aha, which just occurred in January?
February 4th.
February?
Well, as we were doing the Kuhina Papa group was meeting, Mehana was also thinking about doing an aha wahine, and she had a little bit different ideas of meeting on the islands and doing some writing and some other thing. And so when I talked to her, and we had talked about having this 2-day thing, and she was talking about what she wanted, I actually invited her to our very first meeting that we gathered everyone together for Kuhina Papa. We invited, and Mehana facilitated, and she talked about what she wanted to see, and then listened to our group and help us to kind of map out where we wanted to see. And at that time, she had decided she was going to go on, and she was going to try and navigate and get together what she wanted to do, and we were going to continue to meet. And so she wasn't actually part of that meeting group for most of the year.
In the beginning.
Right. And then what happened was, after she went to Windward Community College and some of the events that happened there, she decided she was going to put on a one-day one, and she decided that all on her own but then she contacted our group that had been meeting over a year and said, this is what I want to do. Do you folks want to be part of this? And that's when we came together actually to do the mini AHA.
Right. It's good to make those points, because, and we did utilize it from the standpoint to kind of whet the appetite of all the wahine who are attending and say, please come. And there were a number of women I know after who had told me, oh, I wish I had gone, I missed the deadline, I didn't sign up. So they were all asking about the next AHA coming up in August. But I do want to talk a little bit about what we did do in
February. There were 300 women. Right. We capped
10 days. We didn't know how many people were going to sign up, and so we had set a limit for 300, and what we didn't expect was for registration in 10 days to hit that 300.
Be filled.
Before we ever posted any content on the website. So they didn't even know what they were signing up for. That's how.
Women just want to get together, especially Hawaiian women, so they just signed up. That was very, very refreshing.
And we got a lot of calls after from people that couldn't get in, and so being able to tell them that we had already planned for another one later on in the year that was 2 days, and to be ready for that was really helpful, so that they knew that, well, they weren't going to get into this one, but there's something coming up that they could go to.
Correct. Yeah, that happened so fast, and it was on Windward Community College campus. And I wrote down from memory, and you might be able to add some of the names of people who did present there. Really interesting topics, like Cheryl Lupanui did on Hawaiian leadership. Helen Wai did one on financial literacy, and she's known in her communities, Waianae side, of doing these. Hokuleni Holt did Hawaiian ceremonies for women. Kainani Kahauna Ele, she was Hanao Makahale, so she was looking at women giving birth at home, and there was a whole strand of different health initiatives for Hawaiian women and looking at customary practices in the health realm, and I think that was cool. You did, right? What was yours on?
Well, we did a couple. We did in that strand of there's really definitely an interest for home birthing and going back to traditional birthing customs, and I have a group of women that have been working together over the past 3 or 4 years and researching cultural traditions and practices, and actually working with some of the women out in our community now. And so we did a session on that, and then right after that I was able to go up and listen to Kainani them, and Kainani, Mehana Blake, I think Eo, and Aukahi all told about their perspectives of a home birth and how they pulled culture into their birth, and how they saw the Ho'ailona, but also how families aren't always ready just yet for the birthing at home, and what they did to get their families. Really fascinating, and there continues to be a great interest in this subject. We get calls at KKV every once in a while. Every month, actually, from someone that's interested in home birth or traditional birthing customs, and can they come up and talk? And
that's why it's a 9-month wait, so that the families can prepare themselves.
Right. Were you ready when Cami came home and told
Well, she gave me lots of notice, and I said.
So explain to, here we're having a conversation, we're leaving
a
the audience
conversation.
out. But Cami is your daughter, and so explain from there.
She's going to kill me.
Hi, Cami.
She was very clear that she wanted to give birth at home. And, I work with Hawaiian physicians and other clinicians, and I said, are you sure? And I think that there was enough time for me to understand what she was feeling, and to be assured that she did know what she was doing, that it wasn't just a random thought that she threw out there. And it was also enough time for her to understand that there are some real concerns that we need to prepare for, and that we can do, that there is a happy medium, that she could give birth in the way in which she wanted and still make sure that we are thinking about all of the risks in addition to all the benefits. And and that's, so to me, that's why I always say, sure, you can do that, but that's why pregnancy is 9 months long, so that everybody has time to get ready.
Right. So did she do that?
She did it twice. Yes.
Oh, right. Were you able to be there?
Yes, absolutely. I wouldn't have missed it.
Right.
And now she's furthering her studies actually with a midwife and learning more about it.
And she's just presented on giving birth, a relationship to birthing in the Aina, and she just gave a presentation at an Indigenous Education Conference on the East Coast just recently.
It's a whole different world nowadays. I mean, I was in the delivery room with my daughter when she gave birth to my mo'opuna, all three, and so were her two sisters and her husband. So it was kind of a family thing, and we all got to hold the baby when they were born, at that time. And I mean, I could not ever imagine having my mother there when I gave birth, how many times, or basically my sister, So it's really, I like it. I like that return to that.
I think what you have to think of is when there's a hospital birth, everybody goes and they wait, right? And they're in the waiting room and they're laughing and telling jokes and telling their stories. And what I didn't think of is all the aunties and everybody and all the friends are going to come to my house, right? And then I realized that I had to put somebody in charge and say, get tables, get coolers, get ice, get chairs. You have to be prepared. Right, right. You can't be here, but you can be there, and there's lots of room. And then the joking and the laughing, during all of that waiting. So it really is a family experience. Yes. And again, the females of the family, are the ones that are there. They're just there. Even if it's moral support, they're there. They're there, and everybody is laughing and loving and praying and wanting the best.
Thinking good things, chanting.
Yes.
I know. Oh, yes. So a few other who had presented at this mini AHA was Kalain Uhiva. She talked about Haumea, sacred spaces.
Very well attended.
Right. Kanoina One, who talked about really interesting raising your children in these changing times to be good leaders, and remembering their Native Hawaiian background, or foundation. And Kukahakalau was there. She did daily female ceremonial protocol and taught people chants. So a nice, really a very nice spectrum of different presenters. And we, of course, have an invitation out to all those presenters to please come back and present, because one of the very most common comments we saw on evaluations was, I didn't get to go see so-and-so or so-and-so. Too much to choose from, so please come back again. And so that's what we're working on. What do you recall anyone who presented?
There was a panel of women voyagers, Kapena.
Right.
And I think that was Bonnie Kahapea and Kainani and a couple of the other women who have, who've gone to Micronesia. Terry Keko'olani did a presentation on militarism, and how it impacts us as women in our communities. Dr. Carol Hartley is a pediatrician who spent the last 3 years interviewing kupuna on on their practices in the family, raising a family, and and the results involved food and involved language and just protocols, how you sit, how you eat, how you're all together. And that was remarkable, really, because that was just, she just did kupuna interviews and then sorted them into categories that made sense.
Right. I think what was really interesting is that our topics were very diverse. It was one of the things Ke'omoku told me, Wahine, you guys are right on. You talk about everything. The Kane kind of limited, and the politics is sort of on the side. And I know there are a number of men who wished that they had done that, with their own AHA. But looking at that, what are our strands? So maybe we could explain to all of our viewers outside there, what are the strands that we look for presentations in this AHA?
Well, one of the first things I wanted to say, too, is that we accepted almost all proposals that came in. And so it wasn't, a lot of times you go to conferences and it's you have to go through a panel, you have to decide, or you have to get certain scores and all that kind of stuff. We didn't do that. We figured if there were Hawaiian women that were presenting on this, that meant there was an interest to Hawaiian women, and so everyone came in. Some were more well attended than others, but on a whole, there was definitely interest. People weren't allowed to go to everything that they saw just because of the time constraints. So, but we do have 5 strands. We have a health strand, an education strand, a leadership strand, a culture strand, and a economic sustainability. Because there's a lot of health people and education people, we do have a lot of applications and proposals for health and education. Currently, though, we are looking for more with leadership, culture, and economic sustainability, and we're looking for a lot more hands-on. You know, we had some hula workshops that were just loved by everyone and well attended, so we'd like to get hula and music and kapa and lauhala and whatever we can. People asked for hands-on. They wanted hands-on things, and we're a little bit short on that. So anyone that
cooking demonstrations, there was a big request for that.
There was a big request for cooking. So one of the other things we did at the mini AHA was we used the last afternoon section to divide within these 5 strands, and we asked then all the participants that came, what would you like to see at the next one? And we took notes on that. And so for Kim and I were involved with the health one, and definitely hands-on in cooking. So because of that, we are going to be doing cooking demos throughout the day at the 2-day one, and we're also going to have some container gardening. People wanted to know how to grow foods at home, so at KKV we have someone named Darla Simeona who's awesome with all of that, and so she's going to bring down all the supplies to show people how they can grow foods at home, and everyone will get she already started planting little pots, so at least everyone gets to take home something that comes to her demonstration.
Right. I know, so for our next AHA, we might want to give everybody some information about it, and that is that if you're interested in, we do have a website, and that's www.ahavahine.org. If you go to the website, you'll see that there are a couple of links. There are some links to the mini AHA. There are some demonstrations shown right there, so you can go ahead and you can visit it. And there's also an area to register as a participant, and then also an area to register as a presenter.
As a presenter.
Right, a presenter. A very easy form. When you go onto that link, it's maybe a page long, a couple of things to answer. If you want to apply to just attend, we do ask and gather some data in the beginning of that. So I don't know if, well, before we get to that, maybe you can expound on that, but it's really important for women who are interested in attending to know that right now the price is $60, but come July
15th. After the 15th, so that's a Sunday.
After the 15th, it's going up to $100. For kupuna and keiki, the price is $30, and after the 15th, it will go up to $60. So that's really important to register early. We appreciate the early registration so that we can handle the logistics. Now, this AHA will not be at Windward Community College because we need a bigger venue. Space. So it's going to be over at Leeward Community College this time around. So
we're planning for 800 people, but we can take up to 1,000 women.
Right. So this is huge.
It's huge.
And it's going to be a great time. So maybe you could talk a little bit about when you go online, and there are a series of questions when you're registering, and maybe some of the wahine out there are going to wonder, why are they asking me these questions? Are you familiar with that?
I'm not real familiar with them, but part of what we're doing is gathering a little bit of data so that we know who we are a little bit better. We get to know ourselves. And you talked earlier about the fact that health is kind of important. And statistically, women will take their children to seek, to make sure their children are healthy, and they'll worry about the men in their lives, and they'll think of themselves last if they think of themselves at all. And we know that. The statistics bear it out, and we see it. We see it in our families. So there's going to be health screening. is going to be offered starting at 6:30 in the morning on both days, so that women can go in early, even before breakfast, and just go through the different stations. There'll be health education. They'll take some very baseline data, drawing some blood. There will be HIV testing, if I recall, and and a lot of folks that have information about stopping smoking, heart, cancer, you know, sexually transmitted diseases. So a lot of good information there, and women can ask questions.
And I actually was the one that had the questions up front. And what we wanted to do was we just wanted, like Kim said, to find out a little bit about our women. And it's things like, do you see your Lao practitioner? Do you share food with your neighbor? Do you grow food? Do you eat cultural foods? And just to give us a broad spectrum. But what we also wanted to do was we wanted to put things in a positive light. A lot of times with Native Hawaiians, it's always about, you know, the bad statistics, and we're still high in chronic diseases and in jail and all of this. And we really didn't want to focus on that. We wanted to see really what are the social determinants, and how do they work within our women, and how can we, after we get this data, how can we use it to give more programs, and how can we possibly focus on the successes and strengths? Because you know, I truly believe that when you look at the strengths of a population, that's where you find the answers to a lot of things that happen. So the questions that we are asking the women up front are really just to help us to plan more programs. We have been focusing on the AHA, but one of the things that we were talking about is, you know, we're going to have these, whether it's yearly or bi-yearly. What we'd like is, as the network between women strengthen and and gain knowledge, that there'll be little ones that pop up all over the place, and we'll be identifying needs, and maybe, you know, we need to give just a small little presentation on this here or something here. So that's kind of what all the data is going to help us to see.
Excellent. Okay, so we've gotten through that it's going to be at Leeward, and we know it's going to be August
17th and 18th.
August 17th and August 18th. So that's a Friday, Saturday. They're all day. And we're still accepting registration, definitely accepting presenters to register. Presenters do not pay. So if you are presenting on a topic, you do have a choice if you want to bring a panel, if you want to present by yourself. We have all the necessary equipment set up over at Leeward. So if you need to have, you're going to do a PowerPoint, if you have a DVD, whatever you need, we have for the most part. And so we're really asking for women to dig deep and think, and if you have some Ike to share and you'd be willing to do that with us, we'd love to hear from you.
Well, I was getting excited when I was thinking about some of the presentations that we know are coming in, and there are a couple that are being repeated because we really want them to be. But for example, there's going to be a panel of women filmmakers. You know, those that you know make documentaries that are in the film industry that's normally dominated by men, and we have some awesome Hawaiian women that cover those aspects. So we've got. Are we talking about the panels? We have a great leadership panel. Tell us about the leadership panel.
We're trying to put together a leadership panel, which is looking at women who are in leadership positions that are Native Hawaiian. We already have DJ Mailer, who's agreed to come and present. On
Clara
her panel
Sam is confirmed.
Clara Sam.
With,
she is
with the Queen Liliuokalani Trust.
Trust, right? So QLCC with Clara Sam, and then we're still waiting on Colette Machado representing Office of Hawaiian Affairs. So that should be a very interesting panel. How the panel is going to work is we will have prepared questions for each of them, and then we'll have an opportunity for our community that's sitting in the audience to also ask some questions. We'll have a time limit, of course, but we're looking forward to that. And then another panel we have is a political panel. So these are Native Hawaiian women who've decided to become politicians and actually advocate for their communities on a political level. So invited is Pohai Ryan, Mele Carroll, and
Representative Faye Hanohano.
Right, Faye Hanohano. So we're still waiting to kind of get that nice and put together and pa'a. But it really is interesting. Do you know of, I think we have some of the food panels also that you may have already discussed.
I don't know about panels, but yeah, definitely we have food and health and things that relate to food. We have some really and I'm trying to think right off. One presentation is going to be relating food, and they're going to be making food, but to the struggles that have gone on, and whether it's the fight for water or the fight for land, and naming specific places. I think that's going to be a very interesting panel.
Interesting.
Yeah,
very interesting. Okay, so let's take a look. I have to make sure that we've gone through. Okay, so looking back at this Aha Vahine and our work, how did this transpire? I mean, what kind of meetings do we have to have in order to make something so huge? Really, how do we put this on? So we're looking at who our partners are. And I think it's interesting for people at home to know just what goes on to be able to put something like this off. So what do you offer? I mean, you were in charge of getting us together, and maybe highlight some of the, like how often we get together, the kinds of agendas that we speak about. And possibly if anyone out there has ideas, they could always contact us. It's still early enough that we might be able to entertain some new ideas if we're not already doing so.
Right, so, first when we started meeting, it was supposed to be every month. We kind of met every other month, and it got to be every month. And now that we're getting closer for this one, we're definitely meeting every week. We're very fortunate that we have the Hawaiian, what is PEK's group's name? It's going to kill me, I forgot it. Anyway, the group on Leeward is sponsoring us, and so a lot of our committee, though, is on Kailua, so we meet between Leeward and Kailua.
To be fair, we go back and forth.
We go back and forth. One of the things with having such a large group is the logistics, and so working that all out takes a lot of work. We're still looking for volunteers. You can volunteer. You can be a volunteer and work for half a day, one day. We're going to need a lot of volunteers.
Let's just say that we're all doing this in addition to our normal workload. I mean, there's no paid staff. That, some of us are pure volunteers. Some of us are doing it because our organizations are enabling us to do that or authorizing us to do it. But we're all, it's all kokua.
Yeah, we meet on Sunday. We're not getting
paid. We meet on Sunday.
And going back to the logistics, what I was talking about. So Leeward has an amazing campus. They have this lawn right in the middle that we're going to have a huge tent. But if you just think about tents and chairs and how is that all going to fit, and all the classrooms, all of their classrooms are smart classrooms, which is awesome. So they have all the things in. But we also want outdoor things. We're going to have vendors. We want Native Hawaiian women-owned businesses or run businesses to be able to come. We are going to have Paul Brown's in Kaimaki, Carly Sai and her mom, but we want to have also services that, so women that want to get their hair cut or maybe have their nails done or do something like that, they're going to offer it for a cheaper rate. We're going to have all of that. So just trying to get all of this, and also the food. One of the hits of the first one, and I'm sure the second one, is the food. Tammy Smith and Herbert Hohen, their ohana has been making the food, and it's delicious, and it's all based on traditional Hawaiian ipono. And even from last year, Herbert, we're at the end of the one in January, he's saying, okay, what do you think about this? So they were already thinking of what food they wanted to serve for the next one. But electrical outlets and lighting and all of this kind of stuff is, and media is something that we've been working on too.
Right.
Well, and I think it's so cool to start talking about just the breadth of what we're offering, and the fact that, do your hair, come for a massage, lomi, all these things are going to be available. And let's look at just a typical day. So on Friday, we will be having the early morning screening. And so we will be offering breakfast with your registration fee and lunch. At that lunch, we're going to have a keynote speaker, which is, actually you asked, right?
Yeah. She's not actually at lunch. Merv's going to be at the end of the day.
Oh, at the end of the day.
So okay.
Merv Kitashima at the end of the day as a keynote speaker. And an interesting thing that's happening in that evening, if you want to stay, is our Haumea monologues. Is that what we're calling? Chronicles. Oh, okay. Haumea Chronicles.
But you just revealed the gist of it.
So at that point in time, I can't reveal much more than that, except to say that we'll have some talented women doing poetry, skits, entertaining us. If you are moved, you probably can grab the mic and get up there and do something also, but it's going to be very, very interesting evening. Now, dinner is not included, right?
Dinner's
on
not
Friday.
included, but I think you can sign up on the registration form. So Tammy and her family will be making a dinner, and I think it's just $15 extra.
Right, you can buy
and then,
it,
so if you are planning to stay for the evening, then you just order a dinner, and we'll have it ready for you in the tent.
Right, right. So that will be very interesting for Friday. And then Saturday, again, we start early. Again, we'll have our health screenings. And then we have a number of, I think the way our schedule looked, it looked like 2 offerings, before
and after lunch.
Yeah,
Right.
before
we
and
have
after
we
lunch.
open with a plenary where everybody will be together. We've got some breakout sessions. We've got after lunch, then we've got a plenary session. And I think that's the panel. I think that's the legislative panel.
Right.
A couple of more afternoon breakout sessions, and then we all come together at the end of the day.
And
for our
Saturday is the
final.
lunch keynote speaker, and that is...
Right, the lunch keynote speaker we're going to have to work on, because we did ask Dr. Lili Kalakume'elehiva, and unfortunately, because she has another engagement, she's not going to be able to make it. So all of you out there know we're looking for a keynote. It might be you, and you may want to let us know, because we would love to have you. But I didn't mean to Kalamaya'u gloss over the noon hour. We forgot on Friday, because for the mini aha, we did our protocol to open the aha in the morning. So first thing in the morning, we had some protocol and traditional Hawaiian opening. This time, at this Kuhina Papa, what we are going to do is do it at the midday. So because of the sacredness of noon, so we will be having some protocol there, and everybody can come and participate and watch. And that should be very interesting.
Oh, I think that's the beauty of it, that everybody really can participate in the opening, because we're going to be introducing each island. So island by island, you know, there may be one or a couple of people that actually lead the protocol, but everybody knows their island.
Right, right. I mean, in the mini aha, what we did was highlight practitioners, which was very interesting. It was so hoi hoi. So if you were an Oli practitioner, or if you were a hula practitioner, or did cup or sailed, you were involved in that. And this one, for the larger aha, Mehana Hindus decided, let's honor all of the islands. So, you know, it's really interesting. And I love the way we are looking at putting together all of these women issues, and really in a cultural lens, you know, and infusing all of the way, and the way we should be honoring our Hawaiian genealogies. So I think that's what's really cool too. Okay, so who are really the funders of this? Because when we look at how we've got to network with people, there isn't, even though we're all volunteers, we need to come up with some kind of funding. And of course, that registration fee does not cover all the costs that we're pretty much entailing. So
Absolutely
who are some of our funders?
Well, we try, I mean, Kim, you can go through all that. I just wanted to say about the. I don't want to be the one that forgot someone, so I'm going to let you do it.
Go for it.
What I wanted to say was that the $60 fee, you know, for 2 days is really a great registration fee, and that
Breakfast and lunch.
Yeah, breakfast and lunch. We have, you know, the usual gifts that go out, and so we're only able to do that because we have great funders, and that basically really does just cover the food, and so. Kim will let us know about the funders.
Well, first and foremost, we have to thank Mehana for really working on the funders, the big funders. So the Office of Hawaiian Affairs is our big sponsor. Leeward Community College can't be left out, because if we were holding it at a hotel, you know, there would be a huge expense right there, and we're not, and they're really taking good care of us. The Department of Native Hawaiian Health at the university's John A. Burns School of Medicine is helping to support the health screening. Keola Mamo is really offering what they do on a weekend, 2 days, with the health screening. Queen Liliuokalani Children's Center is participating more than just, you know, that one of their trustees is a panelist, but they actually are supporting scholarships, and they're sending their people, their staff, and some of their beneficiaries as well. Who else do we have? I know I did write a bunch of them down.
QMC, Queens?
Oh, Queens Medical Center is participating.
HMSA?
HMSA Foundation is sharing. Yeah, they're helping to fund the health screening as well. So we really do want to take care of one another, and we've got some really solid organizations. My organization, Papu'olelo Kahi, is a supporter as well.
Right.
And in addition, we're paying the registration for our staff to attend also.
It's interesting that we haven't approached Kamehameha schools. Are we going to do that?
I don't know, Mehana.
Hannah?
Mehana was our person that really worked
wasn't.
really hard to
She's
go out
probably
and,
not
and,
going
and
to.
get a lot of money.
However, aren't you two alumni?
We are alumni.
Yay.
Doesn't mean we can get money out of
Right.
them, but
Of course.
perhaps we can. I mean, I would think that if they're watching this, I would imagine they'd want to be involved because it's really going to be great. So
It's going to be great.
Yes.
Yeah.
And before we move on, I did want to say again, for those of you who are watching the show, you can register online at our www.ahavahine, that's AHAWAHINE.org. Okay, so please visit us online to see if you're interested in registering. If you joined us late, what we're talking about is having a gathering for Native Hawaiian women, to present and also attend and learn about issues that are pertinent to us today. Those issues tend to be centered around health, education, leadership, culture, and economic sustainability. So we had a much smaller AHA, about 300 people, just in February. And this AHA, which we're going to be having in August, we anticipate to be 3 times the size. So we're very much looking forward to doing it. The last one was very well attended, so we anticipate that this one will be also. Now on that, when we're looking at how we meet, we meet weekly now because we have to, we're down the wire. There have been some controversies over the fact that this is a Native Hawaiian women's AHA. And so I wonder if we could maybe just sort of talk about it a little. We have a little bit of time left. And I think it's really important for people out there not to just assume, like, we come to the committee and we're all of the same mindset and we just go forward and there's no discourse about different issues. No, there is, and we talk about these things all the time. One of the issues was, are we going to have presenters who are not Native Hawaiian women? One of the issues that we have to tackle, and that's always difficult because these are our friends, our relatives, our confidants, and by virtue of the fact that they may not have cocoa, does that exclude them from this?
Well, I would take it apart in 2 ways. Can men present?
Right. Okay, so there's can men present?
One application from a couple of
Akane,
yes.
right?
And I think they didn't fully understand. But I don't know. I haven't talked to them then. Yeah. So, but we did have an application from 2 doctors that wanted to present.
So of course, when we receive an application from Akane to come and present with all of these wahine, we look and we say, what are they thinking? This is for Hawaiian women. Hawaiian women are supposed to present, but in fairness to them, they may not have thought that.
Right.
They may have been working with Hawaiian women for 30 years, and they have something to offer, so they're very interested, but didn't quite realize that.
But it was.
That we're looking at empowering our women to be presenters also.
And so, as Manu has stated, Manu and I didn't agree on the Native Hawaiian.
Which one?
On the,
No.
on having Native Hawaiian women, and I think that. I wanted to include someone that I worked with very closely who is part Cherokee but not Native Hawaiian, but has been chosen by our kupuna to pass down. She's been a student of Levon Ohai and Alapa'i and Alva, and very much a part of our group and part of the research that we've been doing and part of the presentations all along. And so and she actually presented with us on the first one, and I really wanted to have her present, but it was the majority of the committee that had decided, and everyone got to voice their opinion. It wasn't an easy conversation. For me, I feel like I'm strong enough in knowing what I do and what I bring to the table that if I have someone that was taught by my kupuna and she can offer information that will help our women, that doesn't make me weaker, it makes me stronger. But many of the other women on the committee decided that
I just want to say for the record that, you know, we did have the discussion, and it's really interesting how we work because we're talking on email. We can't always get together. We can't always call each other. And when you had explained who she was, then I said, I defer to everyone else. You know, I said, I've said, and the fact that once you had clarified, you know, who this person was, that you knew them, and you added more information, I said I was willing to trust you and your judgment. And we did bring it to our meeting, and then we did still talk about it, and then that decision was made. So it isn't easy, but I have really enjoyed the opportunity to be able to go through this and talk about these things. They're not, it's not easy to come up with these.
And it wasn't just the two of you either.
Right.
Yeah, I mean, that
was,
but everybody got to say something.
It was a collective
and you know,
decision.
and although it wasn't a facilitated session, we really went through really what an ailike process, because you understood, you were able to say what you wanted to say, but then you could live with it.
Right.
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 And I mean, and that's before we ever got to the actual outcome, you know, the consensus building. But we really went through a process where, you know, we were able to figure out what we could live with, what we couldn't live with, how we would change, you know, based on the decision. And I mean, I think we just intuitively implemented that whole ailike process and came to a place where we could all live with the outcome.
Well, and I think our group is just representative of all women out there, and what colonialism and what all of our history has, how it's affected each one of us, and it's affected each one of us differently. And you know, and I feel like when you have so much that has been taken away, there's different degrees of feeling that you have to fight and not fight, but you know, you have to get it back or to hold your place. And if anyone, you know, does something, and so I think that we have a spectrum in our group of doing that, but we're just representative of all the women out there and the thoughts and the feelings and the struggles that they go through on a daily basis. And but the fact that we can work together and we can discuss these things and continue to move forward, I think is awesome. You know, it's an awesome group.
I agree. And I think also on that note, I mean, since we're talking women, men, another interesting is the fact that we do welcome Mahu to come and sit and join us and be a part of the Women's AHA. And that also was something that we discussed in committee. And so you weren't in the committee, so you don't know what we said, but you're bad. No. But, you know, and we decided that there was definitely a place, and they were welcome to come. And we had a number of Mahu participate in the mini AHA, and we are anticipating that we'll have a number of Mahu come again.
Also, for me, there's also a point of difference, because we know that there were some Mahu that went to the AHA Kane and then came to, you know, and then either came or are planning to come to the AHA Wahine. So where on one point we may be welcoming, but I think that as individuals, you know, there's some sort of need there that we may not be able to address or fulfill, but there is something there that, you know, may be brewing out there that may come out for them.
Which is why we were encouraging, okay, now you guys have to make your own as soon as you're ready.
Aha Mahu.
On that note, we are going to leave. We have actually run out of time, so I really want to thank Mililani and Ku'ule for coming and sharing with our audience at home. And all of you women, please get on, you know, your computers and register for the AHA Wahine coming up in August. And we look forward to seeing you there. And also, especially if you want to be a presenter, please sign up. Mahalo nui, everyone. Ahui ho.
Ahui ho.
Yeah, mahalo.
Thank you.